Good day, ladies and gentlemen. Today's topic, antibiotics, bactericidal versus bacteriostatic agents and their modes of action. We will delve into the fascinating world of antibiotics, exploring the crucial distinction between bactericidal and bacteriostatic agents, and understanding how they work to combat bacterial infections. Antibiotics have revolutionized modern medicine by saving countless lives and preventing the spread of deadly bacterial diseases. Let's begin our journey by discussing the fundamental concepts. Antibiotics are chemical substances produced by microorganisms or synthetically designed to inhibit the growth or kill bacteria. Alexander Fleming's discovery of penicillin in 1928 marked the advent of antibiotics, leading to a medical revolution. Fleming, Chain and Florey got the Nobel Prize for this discovery in 1945. Although Professor Selman Waxman revolutionized the use of different antibiotics and is hence known as the father of antibiotics.
Types of antibiotics as broadly classified are bacteriostatic and bactericidal. Bacteriostatic antibiotics inhibit bacterial growth and replication, but do not directly kill bacteria. Mechanisms of action. 1. Inhibition of protein synthesis. Tetracyclines and macrolides interfere with bacterial protein synthesis by binding to ribosomes, preventing further growth. 2. Metabolic pathway disruption. Sulfonamides, such as sulfamethoxazole, inhibit folate synthesis, a key component in DNA and RNA production. 3. DNA synthesis inhibition. Trimethoprim targets bacterial DNA synthesis by inhibiting dihydrofolate reductase. Examples are tetracyclines, macrolides, erythromycin, azithromycin, clarithromycin, roxithromycin, telithromycin, fidexomycin, sulfonamides, trimethoprim. On the other hand, bactericidal antibiotics are agents that kill bacteria directly. Mechanisms of action. 1. Disruption of cell wall. Beta-lactam antibiotics, such as penicillins and cephalosporins, inhibit peptidoglycan synthesis, causing cell wall rupture and bacterial death. 2. DNA damage. Quinolones, like ciprofloxacin, interfere with DNA replication and repair, leading to bacterial cell death. 3. Inhibition of protein synthesis. Aminoglycosides, such as gentamicin, disrupt protein synthesis by binding to ribosomes, but in this case, ultimately killing bacteria. Examples are penicillins, cephalosporins, quinolones, aminoglycosides, rifampin. Beta-lactam antibiotics like penicillin, ampicillin, amoxicillin, cephalosporins, and cefamycins, cephams, monobactams, carbapenems, and carbocephams inhibit cell wall synthesis. Result: weakened cell wall, osmotic pressure, and cell lysis. Quinolones cause DNA damage by inhibition of DNA gyrase and topoisomerase. Result: DNA strand breakage and cell death. Aminoglycosides like gentamicin inhibit protein synthesis. Aminoglycosides binding to 30S subunit of ribosomes, leading to misreading of mRNA and impaired protein synthesis. Result: accumulation of abnormal proteins, cell death. Macrolides, clindamycin, chloramphenicol, linezolid, streptogramins also inhibit protein synthesis by binding to 50S ribosomal subunit. But bonding is a bit different than that of aminoglycosides. Thus, macrolides cause prevention of tRNA binding and peptide bond formation. Result: slowing of protein synthesis, bacterial growth inhibition. Tetracyclines also inhibit protein synthesis by binding to 30S ribosomal subunit. But bonding is a bit different than that of aminoglycosides. Thus, tetracyclines cause prevention of tRNA binding and peptide bond formation. Result: slowing of protein synthesis, bacterial growth. Polymyxin B targets cell membrane synthesis by disrupting the membrane integrity, leading to the permeabilization of the bacterial cell. Result: weakened cell membrane, osmotic pressure, and cell lysis. G. Rifampin specifically inhibits bacterial RNA polymerase, the enzyme responsible for DNA transcription, by forming a stable drug enzyme complex. Result: inhibition of transcription and cell death. H. Sulfonamidase and trimethoprim interfere in metabolic pathways by inhibiting bacterial folate synthesis. Sulfonamide inhibits conversion of para-amino benzoic acid, PABI, to dihydrofolate. Trimethoprim inhibits the conversion of dihydrofolate to tetrahydrofolate. Result: slowing of protein synthesis, bacterial growth inhibition, and later on death.
Dear students, if you ever feel that we are adding any value to your learning, then please subscribe to our channel and press the like button for the individual videos. This will encourage us to post more quality content in future.
Here's a general overview of some common antibiotics and the diseases they are often used to treat. 1. Penicillins. Amoxicillin, used for respiratory infections, urinary tract infections, UTIs, ear infections, and dental infections. Penicillin G, effective against various bacterial infections, including streptococcal infections. 2. Cephalosporins. Cephalexin, prescribed for skin and soft tissue infections, respiratory tract infections, and UTIs. Ceftriaxone, used for severe bacterial infections, such as meningitis, gonorrhea, and certain respiratory infections. 3. Macrolides. Azithromycin, often used for respiratory infections like bronchitis and sinusitis, as well as skin infections. Clarithromycin, used for respiratory tract infections, including pneumonia and ear infections. 4. Fluoroquinolones, ciprofloxacin, effective against urinary tract infections, respiratory infections, and certain types of diarrhea. Levofloxacin, used for respiratory and urinary tract infections, as well as skin and soft tissue infections. 5. Tetracyclines. Doxycycline, prescribed for respiratory infections, skin and soft tissue infections, as well as some sexually transmitted infections. 6. Aminoglycosides. Gentamicin, used for severe bacterial infections, including those affecting the bloodstream or urinary tract. 7. Sulfonamides and trimethoprim. Sulfamethoxazole trimethoprim, TMP-SMX, often used to treat urinary tract infections, respiratory infections, and some types of pneumonia. 8. Vancomycin, reserved for treating serious infections, particularly those caused by antibiotic-resistant bacteria, such as methicillin-resistant Staphylococcus aureus, MRSA. 9. Metronidazole, used to treat infections caused by anaerobic bacteria, such as certain types of gastrointestinal infections and dental infections. 10. Antibiotics for tuberculosis. Isoniazid, rifampin, ethambutol, pyrazinamide. These drugs are used in combination to treat tuberculosis, TB. 11. Antibiotics for sexually transmitted infections. Depending on the infection, antibiotics like azithromycin, ceftriaxone, and doxycycline may be prescribed. 12. Antibiotics for Helicobacter pylori infection. A combination of antibiotics such as clarithromycin, amoxicillin, and metronidazole is often used to treat H. pylori-associated gastritis and peptic ulcers. Antibiotics are often classified into generations based on their development and spectrum of activity. These classifications are somewhat fluid, and not all antibiotics fit neatly into specific generations. However, here's a general classification of antibiotics into 4 generations. A. First-generation antibiotics. 1. Cephalosporins such as cefazolin, cephalexin, cefadroxil 2. Penicillins such as penicillin G, penicillin VB, second-generation antibiotics. 1. Cephalosporins such as cefuroxime, cefoxidin 2. Fluoroquinolones such as ciprofloxacin, norfloxacin C, third-generation antibiotics. 1. Cephalosporins such as ceftriaxone, cefotaxime, ceftazidime. 2. Fluoroquinolones such as levofloxacin, moxifloxacin D, 4th-generation antibiotics. 1. Cephalosporins such as cefepime. Please note, macrolides are considered to be a group of antibiotics that do not fit neatly into the traditional generation classification system used for antibiotics, which is primarily associated with cephalosporins and penicillins. Macrolides, such as azithromycin and clarithromycin, have their own unique classification based on their chemical structure and mechanism of action. So, to answer your question, macrolides are not typically classified into a specific generation of antibiotics. Instead, they are categorized based on their distinct characteristics as macrolide antibiotics. These antibiotics are commonly used to treat respiratory tract infections, skin infections, and other bacterial infections. It's crucial to follow your healthcare provider's instructions when taking antibiotics, including completing the full course of treatment, even if you start feeling better before it's finished. Misuse or overuse of antibiotics can lead to antibiotic resistance, where bacteria become resistant to the drugs, making infections more challenging to treat. Always consult a healthcare professional for proper diagnosis and antibiotic treatment. Responsible antibiotic use is imperative to mitigate the rising threat of antibiotic resistance and ensure these life-saving medications remain effective for future generations. Thank you for your attention, and I hope you now have a deeper understanding of antibiotics and their roles in combating bacterial infections. Please press the like button for this video if you feel that this video has benefited you. Thanks again. See you soon.